All right, today we're talking about thoracic outlet syndrome, or TOS. We're going to dive into some clear, actionable steps you can take to manage it. And the best part, no surgery is involved. This is all about smart, simple fixes that can make a huge difference.
So, does this sound familiar to you? That really frustrating arm swelling, maybe a numbness that just won't quit, or that deep, heavy feeling in your arm and hand? If you're nodding along right now, you are absolutely in the right place. These are the classic signs we're going to tackle. Okay, so what is actually going on here? The easiest way to think about thoracic outlet syndrome is kind of like a plumbing and wiring problem. You've got this space between your collarbone and your first rib, right? That's the thoracic outlet. And when it gets too tight, it literally puts the squeeze on all the vital nerves and blood vessels running through it to your arm. So our whole mission, our entire goal is super simple: create more space. And where do we start? Well, our first stop, and honestly, this is probably the most important one, is your posture. Seriously, before you even think about anything more drastic, this is the foundation. If you can get this right, everything else starts to fall into place. I love the way the source material puts this. On one side, you've got the problem posture. It calls it hunching like a gargoyle. You know the one. We're all guilty of it at our desks. The solution? It's the complete opposite. Get that chin back, let your shoulders drop down and relax, and keep your head neutral. That right there, that's how you start actively creating that space we've been talking about. And listen, this isn't just some vague advice. This is backed by hard data. Get this. Studies show that when you have that poor posture with your shoulders rolled forward all day long, you can crank up the pressure in that thoracic outlet by up to 30%. I mean, that's a huge self-inflicted squeeze that you and I have direct control over. So, okay, how do we actually maintain that good posture, especially when we're stuck at a desk? Your workstation is everything. The goal here is to set yourself up for a win. Get that computer screen right at eye level, no looking down, and check your elbows. They should be at a nice, comfy 90-degree angle with your feet flat on the floor. That's it. No more hunching. And this whole idea of keeping things neutral doesn't stop when you log off. It's just as important when you sleep. Try to sleep flat on your back, or if you're a side sleeper, on your good side. And here's a pro tip: use a thin pillow. The goal is so simple, right? Just avoid cranking your neck into some weird, awkward position for 8 hours straight. All right, so we've tackled our static posture, how we sit and sleep. Now let's get things moving, because movement is medicine. And this next part is all about active, specific exercises that can bring some serious relief. Okay, this first one, it's an absolute game changer. It's called a nerve glide, and it's designed to gently free up those trapped nerves. It's so easy. You just sit tall, extend your arm out with your palm up, and then slowly tilt your head away from that arm. No jerking, just a nice, gentle 2-second hold and repeat. The source material calls this one seriously underrated, and for good reason. It can bring almost instant relief for some people. Next up, the classic doorway pec stretch. Here's why this is so important. When your chest muscles get tight, they pull your shoulders forward, which, you guessed it, shrinks that thoracic outlet. This stretch does the exact opposite. Just find a doorway, place your forearms on the frame, and gently step forward to open everything up. Hold it for 30 seconds. The recommendation? 10 reps every single day to keep those muscles from seizing up. And hey, we've got even more tools for your movement toolkit. We're talking about simple things like shoulder rolls right at your desk. Or grab a tennis ball and use it against a wall to massage those super tight neck muscles. Even just applying a little bit of gentle heat before you stretch can make a world of difference in loosening things up. It's all about those little habits that have a big impact. Okay, a really important warning here. While movement is medicine, the wrong kind of movement can definitely make things worse. For now, it is absolutely essential that you skip exercises with overhead reps. I'm talking about things like the butterfly stroke in the pool or hitting the bench press. Just press pause on those until your symptoms have really calmed down. So, to bring this all home, let's zoom out and look at the bigger picture. We've nailed down posture, we've covered movements. Now it's time to add in some key lifestyle factors that are going to support your recovery from every single angle. And you can see here just how these small lifestyle tweaks create this huge ripple effect. Think about it. Stress makes your muscles tighten up, right? Well, that's where something simple like breathing comes in. Or dehydration. It can cause your tissues to swell, making that space even tighter. So staying hydrated is a must.
And then there's getting enough potassium from foods like bananas or sweet potatoes that can really help calm down your nerves and stop that heavy, crampy feeling.
And honestly, this is the core message of the whole non-surgical approach. Look, none of these things is a magic bullet by itself. It's not going to fix everything overnight. But when you consistently stack these small positive habits on top of each other day after day, that's when you create a really significant, lasting difference. And just to round things out, the source material also points to a few other powerful factors. Things like managing your weight, which can literally widen that thoracic outlet, actively reducing your stress, and even just taking light walks to improve blood flow. They all contribute to the exact same goal, creating more space and less squeeze. See? It's all connected.
I want to leave you with this quote. It's directly from the source material because I think it's just so important. It says, "You're already doing the hard part, listening to your body." And that's so true. Just by being here, by looking for this information, you're paying attention to the signals your body is sending. And that's the most critical step you can take.
So that wraps up our deep dive into non-surgical solutions for TOS. Now the only question left is, what's the one small change you're going to make today?